Hey, 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 how's it
Hi, good
going?
evening. Good evening, everyone. My name is Sharon Moreno, and I'm a family nurse practitioner, and this is my super awesome co-host, Ray Martinez. Hi, Ray. How's your
How's
day?
it going? Pretty busy. It's been a busy week, man. It's end of the year for me, so everything's, coming together. That kind of deal. But I've been busy. But
Production's
hey, we're
good.
here. We're ready to go. Uh, we're ready to hit what we're gonna do here, right?
Absolutely. So our topic today is going to be hypertension, actually.
Uh-huh.
We're going to talk about high blood pressure. That's an important topic. So, you know me and statistics. I love statistics. So I have
Yeah.
three important piece of statistics that I've dug up. The first one is about 46% of adults with hypertension are actually unaware that they have hypertension. So
Hmm.
we have about 46% of people out there who actually have high blood pressure and are completely unaware.
Wow. Yeah, well, that's why it's called the silent killer. It's a
There
condition
you
that
go.
affects over a million people worldwide, guys. Over a million people worldwide, often without a single warning sign. Oh man, that must be ugly. Hypertension or high blood pressure, as we in the non medical field call it high blood pressure quietly, it sneaks up on you, damages your heart, your brain, the kidneys every day, making it one of the leading causes of death and disability across the wide world. But what exactly is hypertension?
So we're definitely going to talk about that today. That's very important. I have another two pieces of interesting statistics. So the
Cool.
next one is less than half of the adults that actually have high blood pressure are actually diagnosed and treated. So we have about 40%, 42% of individuals who have the diagnosis are actually receiving treatment and have the diagnosis. So
Wow.
again, this is pretty devastating, for it to cause so much havoc in people's life. People are not getting the diagnosis promptly or treatment. 42%.
Man. Yeah. And I guess age and family history, obesity, comes into play. The lifestyle, high salt and alcohol intake, smoking, chronic stress, and
Yes,
that kind of deal. All of those things come into play. Uh, man, I don't know.
absolutely.
Basically anything we do, we're gonna get it somehow.
You're not wrong. You're not wrong. Now, only about 1 in 5 adults who have high blood pressure, 1 in 5 are actually under control. So the people who actually are diagnosed, only 1 out of 5 are truly
Wow.
controlled.
So in our case, it's one, two, and three others. I would say you're the one that has it under control, or you better have it under control.
My blood pressure is actually pretty good. I don't have an issue with that. I don't take any
Yeah.
medications for that. Not yet, anyway. Who knows about tomorrow? But
Yeah.
we're good at this point. So those are the three pieces of statistics I wanted to go over. First of all,
Cool.
we talked about that. Uh, Guys, we always start with the legal disclaimer.
Disclaimer.
While that's up, I just want to remind you that if there are particular topics that you'd like me to discuss, please start to put those in the comment section or your highs. I'd love to hear from you as well. Know that you're, watching my show, and we have a brother in
Cool.
arms,
Solid.
Saul Enriquez. Hi, how are you, Captain?
How's it going, man? Cool.
So glad to have you. He was our educator, so he did a lot of our PowerPoints and education and stuff like that. So that was very helpful. Very good educator.
Cool. So definitely ask us some questions. This is one of those topics where we're more familiar with, or if we're not familiar with it, at least we've heard of high blood pressure. I mean, you go to Walmart and you have those funny machines that you put your arm in there, and
Yes,
everybody asks, the kids, hey, I want to play that game. It's not a game, baby. It's to, you know, it's for your blood pressure, that kind of deal. And so we're kind of used to it, but we don't know exactly why we get it. We don't know exactly how we get it. We don't know exactly, you know, when we get it, but we will eventually get it. I guess.
Absolutely. Yeah, and I just want to remind everybody that again, if you have questions, I don't charge for questions. You can always text me or send me a message to Facebook. If you text me, 956-640-6963 is my cell phone number. If you message me, just message me through Sharon Moreno at in Facebook and ask those questions. If you have questions about certain conditions, certain medications, whatever health related questions you may have, ask those questions. I'm here as a resource to you. Again, many people use me and I don't charge. I only charge and if I'm going to provide a service. But if I'm answering questions, I have no problem with that. So please.
Wow. Yeah, 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 definitely. I'm sharing here the show, so hopefully we get some and wow, here we go. And cool. So
Right.
ask us ask us the questions, you know, and we'll get you some answers, or actually Sharon will get you some answers because you don't want to hear my answer.
We
And
can and then
so,
we can compare answers.
yeah, yeah, yeah. There you go. And definitely follow follow and share, right? Follow and
That's
share,
right.
guys. So here we go. It's Sharon. It's live on my profile page as well, and it's also live uh, on the Gold Rush Health Solutions YouTube channel. So let's see what happens on that. All right. So Gold Rush Solutions presents
Hypertension. That's what we're going to talk about today. So
attention.
so let's get some general information. This is an overview period about hypertension. This occurs when the force of blood pushing against the artery walls is consistently too high, making the heart work harder to pump. So basically, it's an overuse. We're making the heart
Mm,
work harder than it should.
yeah,
And
yeah,
as
yeah.
you mentioned earlier, it's known as the silent killer. So a lot of people
Yeah.
kind of know that about the silent killer kind of thing, and it's very true for multiple reasons. Normal blood pressure for adults, and we're talking about adults for this particular course. Normal blood pressure for adults should be lower than 140 over 90. That's important.
Mm,
Blood pressure is determined by the amount of blood the heart pumps and how hard it is for the blood to move through the arteries. So resistance, a lot of different things that we'll talk about can affect blood pressure. But these are some interesting things. Um, these are some interesting pieces of information regarding hypertension just to start with, just so that you
mm.
have a general idea of, what affects
Yeah,
hypertension.
yeah, yeah.
And
So
we
yeah.
have a question here. What kind of damage can happen to our bodies if hypertension is uncontrolled? So that is a great question, and that's actually going to be in the slides later on today. So I will point that out once we get there. But yes, quite a few things can happen if blood pressure isn't controlled, especially long term.
On the long term. So good question. Yeah.
Yes,
All right. Continue
absolutely.
then.
So we let's talk about symptoms a little bit. Most people have no symptoms, even if blood pressure is dangerously high. So that can be a reason why it's known as the silent killers, because most people feel well or have no symptoms at all. So there's not necessarily a warning as to, oh, wait, my blood pressure could be high. There's an
Hmm.
issue. So that's issue number one. And then we talked about the statistics. About 46% of the adults that have hypertension aren't aware that they do. And well, this is a big reason as to why they're likely not aware, is because, again, the lack of symptoms. If we were to have particular symptoms, I'd be like, that may mean I have high blood pressure. Let me look for that. But
Yeah, yeah.
most people tend to be reactive instead of proactive. And we want to change that way of doing things. When you're reactive, you have symptoms, you go to the doctor and you get evaluated versus being proactive. You have no symptoms, you feel well. and you go for things like annual labs or a physical exam. And these are when we can catch things early with better outcomes.
Right, right. So obviously you have you get the headaches, the nosebleeds, the shortness of breath. I understand also you have some visual problems and maybe some chest pain. You know,
Yes,
typically, yeah, typically
these are
no
the
no
most common
symptoms
ones.
until it's significant damage has occurred, right? And so
That's
that's why
correct.
it's the silent cleaner. So all of a sudden, nothing, da, 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 and then all of a sudden, and you have now symptoms, and you now have complications, which stroke, kidney damage, visual loss, uh, you know, uh, heart disease, those kind of things, right? That come into play.
Absolutely, yes. And so, as you mentioned, if there are some symptoms, sometimes people can have things like headaches, nosebleeds, shortness of breath. Now, again, remember that these particular symptoms can be related to other things, but for the purpose of hypertension, these could be some symptoms that you may have if your blood pressure is running high.
Right, right. No, that makes sense. Causes.
So causes, what can cause hypertension or high blood pressure? Things like plaque buildup in the arteries. So poor diet, family history can cause that. Where we have cholesterol build up, plaque in the arteries. People who have thyroid problems, if you have a
Hmm.
low thyroid, that can decrease your pulse, making the body compensate by increasing the blood pressure.
Right, right.
Again, remember, blood pressure has the purpose of that is to get blood to circulate throughout the body. Whereas high thyroid increases metabolism, which increases heart rate and blood pressure. So
Hmm.
thyroid, either way, either high or low, can create issues.
Yeah.
Things like congenital defects, things that you're born with can cause this. A condition called obstructive sleep apnea. This is when you have
Hmm.
periods, seconds, um, where you stop breathing when you sleep.
Wow.
Kidney disease, different kinds of kidney diseases, illegal drugs such as cocaine and amphetamines, and cough and cold medications, some pain relievers, birth control pills, and other prescription medications. So you can have these particular things that can cause high blood pressure.
So you can have some. You could be doing some good things, and they're gonna create some problems in the
That's
blood
right.
pressure area, like for instance, birth control pills, and your cough medicine. Hey, you have a cough, you take some cough medicine, and you're thinking, well, it's I need it, but all of a sudden there's those side effects. So ah,
Yes. And so
they'll
that's
get
why
you
it's
one way.
important that you always, speak to your medical provider regarding these kind of things, especially people who already have the diagnosis, because they are like we mentioned here, even things like cough and cold medications, like the sufedrin, and these medications can cause an increase in blood pressure.
Hmm.
So you have to take that into consideration.
Yeah, yeah, yeah. No, that's. I mean, hey, the more information you have, the better. Because otherwise, hey, you're gonna have you're gonna have some issues. And you have to be able to deal with these. Um,
Absolutely, yes. It can cause devastating issues, especially long term. So let's look at some risk factors. Let's look at people who are at higher risk for this issue. Age, of course, age always plays a factor in everything. The risk for hypertension increases with age. So the older we are, the higher the risk we have. Race. This is actually
mm,
more common in African Americans. So if you have
wow,
African American blood, then you're at higher risk for high blood pressure. We
wow,
mentioned before family history. You're more likely to develop hypertension if you have a parent or a sibling, grandparent with the condition. So the more family members you have with this condition, the more likely it is for you to end up with this. Genetics plays a big role. I always tell people, look at your parents, look at them, and that's essentially how you could end up if you don't make changes. You know, parent suffers from high blood pressure, diabetes, kidney disease. If you don't maintain a healthy lifestyle, exercise, maintain a weight, eat appropriately, drink water, rest, then you're basically looking at yourself in the mirror with those particular chronic conditions. We can change that by behaving differently most
yeah.
times.
In other words, the cycle can be broken. you know.
Absolutely, yes. Yes, yes. It
Yeah.
can. Obesity, of course, that affects so many things. Excess weight causes change in the blood vessels, kidneys, and other parts of the body. Weight gain and being overweight is always going to cause an issue and a multitude of conditions, but specifically for high blood pressure. The higher the weight, the likely you are with plaques that are
Mm.
occluded, which is what this picture shows to the right of the PowerPoint. We have a normal vessel that's nice and open with, little to no plaque. And then we have somebody in the middle stages with pre-hypertension where they already have plaque formation there. So now that artery that was open and with an adequate flow of blood now is being compromised somewhat. And
Mm.
then you end up with a hypertension stage where you have significant, moderate to significant plaque in the arterial walls. And so the blood is having a difficult time flowing through this. And so when that happens, the blood has to pump harder to get the blood to where it needs to be.
It's got to squeeze right through it. It's kind of like right now today that we had a lot of rain, and water started raising because they couldn't go, they couldn't funnel through the drainage system because it was being
Yes,
plucked up. So that's a good
yes,
example of high blood pressure. The rain couldn't drain through it because the drainage were plucked up with branches and trash and stuff like that, and so they had to
yes.
work harder. And we have damaged cars and all kinds of damage. So it's just like that, guys, except it's the
That's
vessel, the
that's a good
the
that's a
vein.
good analogy. Thank you. That's a great analogy. That's I like that. So we have a question here.
Hey, Norma.
Uh, Hi, Norma. So she asked, do people that have hypertension due to anxiety need hypertension medications? So this is interesting
Good
here
question.
for a couple of reasons. So the issue here is we need to always treat the underlying cause. If the hypertension, remember our body tends to react to things. So if I take out a gun and point it at someone's head, likely the blood pressure is going to shoot up. So our body responds to things. And the question would be, well, do I take a blood pressure medication because my blood pressure shot up because someone pointed a gun in my head? No. What you would do is try to get out of the situation and remedy the situation so that blood pressure would go back to baseline. So in this particular case, if the issue here is anxiety, then I'm not going to treat the blood pressure. I'm likely going to treat the anxiety issue. But
Makes sense.
there's a lot of different conditions that that can increase the blood pressure. Um, and we always have to look at the underlying issues here. And that's important. So that's actually a really good question. Thank you, Norma.
Cool, cool. All right.
So another issue here is lack of exercise. So inactivity also causes an issue where we tend to have higher heart rates and higher blood pressures. Again, lack of activity can lead to the occlusion of the arteries, and that plays a big role on what our blood pressure is. Tobacco or vaping, a lot of people seem to think, well, I'm going to stop smoking and I'm going to start vaping. They essentially are equal when it comes to a lot of the different situations, health related conditions.
And I heard
What
it's worse than smoking in certain.
and the reason that we think that it could possibly be worse is simply because there's not enough research about it. So cigarettes have been around like forever and ever,
Hmm.
and anytime that we have something that's more long term, it allows there to be more adequate studies and research regarding
Right.
this. Now vaping is somewhat of a newer phenomenon, and so we don't necessarily know long term the completely know the long-term effects that they can cause upon people, but I don't recommend going from tobacco to vaping or doing either or. They both have their issues. I
Yeah,
have
yeah, yeah.
another comment here from Saul, and he says, unfortunately, every medication has side effects that can cause other problems, and that's
Yes.
exactly correct. So what I tell people is they have to choose their poison, really. Um, so if you're having, we talked about particular symptoms with the blood pressure, or particular, we haven't got into, what the issues can be long term, but let's say you're having, headaches, let's say you're having nosebleeds. We
Mm-hmm.
talk about that, and you start a medication. Then we're going to discuss medications, which I also have in the PowerPoint later on. But most common side effects of particular medications for blood pressure are things like cough, a dry cough. It can be some swelling to your ankles. It can
Mm-hmm.
be, of course, lowering the blood pressure to the extent where now you're symptomatic with low blood pressure, feeling weak, dizzy. And so only the patient can decide whether, yes, this is a risk I'm willing to take, or no, this isn't a risk I'm willing to take. So
Right.
us as healthcare providers have to do a really good job with educating. Um, I never choose treatments for patients. I simply say, these are the options that you have. And,
Hmm.
these are pros and cons for each one of these options. You being the patient and the captain of your ship, how would you like to proceed as far as treatment? Because that's really important.
Wow. I guess that's true. You would think that, the health professional would say, do option A, do, that kind of deal. But you're right. Yeah, they have to have a sense of ownership and have a
Yes,
own and take it from there and say, you know what, I'm gonna follow this route, and that's what I want to do. And
yes, yes,
but yeah.
absolutely. Yes. Yes, we're not, as healthcare providers, we're not to enforce, or I don't want to say enforce, but we're not to, uh, we have our own biases, we have our own way of thinking. And, I may have a patient, for example, who's a Jehovah Witness and needs a
Yeah.
life-saving blood transfusion, but yet, they don't believe in blood transfusion. So they may decline it. And, if I'm not practicing the same religion, I can place my bias on that and be like, well, this is life saving, you should do this. But the reality is, it's not my life, it's not my health. I'm just there to simply guide the patient and say, look, I recommend the blood transfusion based on the laboratory values and what's going on. But if you don't get the blood transfusion, these are the risks. If you do
Mm-hmm.
get a blood transfusion, these are the risks also. There are risks with blood transfusions as well.
Mm-hmm.
So again, our job really is education, providing education and not imposing treatments or decisions on patients. It's up to them, and we just offer education and support.
Wow. Pretty cool.
So let's continue here. Other risk factors. There's a lot of risk factors for hypertension. So too much salt. If you
Mm.
end up eating a lot of salt, this can cause fluid retention, which causes an increase in blood pressure. The recommendation is about 2 grams of sodium a day. So, how do we get to that? We have to read labels. And I know that's an art in itself, which, down the road we can always talk about it. That's something that people are interested in. But salt can create issues. Low potassium can be lethal. The
Wow.
potassium helps yes, it balances the amount of salt in the body cells and can cause heart arrhythmias affecting blood pressure.
So eat more bananas.
Palpitations. Yes, people can have palpitations and a whole chest pain, shortness of breath and stuff. If potassium levels are low, that can cause significant problems. Of course, we have alcohol consumption. Basically, that creates issues with most health related issues. Stress. I mean, stress is, as you mentioned, just kind of by surviving and living, we're all going to essentially have one of these. I'm sure everybody has at least one or two of these risk factors that I've listed already, if not more. But stress plays a big role. We got to find effective coping mechanisms to help cope with the day to day stresses. uh,
Mm-hmm.
there's no way we're going to be able to eliminate stress. We just have to be able to cope and manage it,
Yeah.
so that it doesn't gravely affect, our health. Other conditions like kidney disease, diabetes, sleep apnea. We talked about these earlier in the slide. But certain conditions worsen your blood pressure. And of course, pregnancy. Pregnancy is one of those things that'll throw your body completely off balance.
Yeah. 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 Wow. That's sad, but it happens. Uh, man.
Absolutely.
Um, the risk factors. I mean, they're there. I mean, we have the information. or at least you, if you don't have it, you can get it. This is why, guys, I would suggest you share this, send it to a friend, send the link to your friend, or just share and send that shared link to a friend so they can see it. So at least they have it and they can always see it later. Because this is information that you know we we hear, but we kind of ignore. No, not me. No, you know, yo estoy bien. That kind of deal. We play that. Hey, that card's not for me. That type of deal. And all of a sudden, boom, we are. And so, uh, so
Yep, that's exactly the issue. Education is invaluable. And so anytime there's education is being offered, especially free of charge, it's a good time to take it and evaluate that. I know when I do my continuing education, it's not free of charge. So I receive, attend videos and classes and things like that, and it's not free. I have to pay a pretty penny. So anytime a medical professional is offering you free education, that definitely is
yeah.
a good opportunity to take that.
Well, it's a time to take advantage of the time and the information that's coming in, and you know store it, and bring it into your brain and that kind of deal. Right? Take some notes, guys. Take some notes, and man, some of these stuffs we might not think are an issue, and yet we are. Even like we've heard with cigarettes, secondhand smoke is bad. Well, you know what?
Yes,
There's secondhand vaping. As it still smells. You can tell that somebody's smoking just because it's not a cigarette and somebody's smoking. Vaping right next to you. You can tell they're smoking because it does have a smell. Does
it does. That's correct.
and so it's again secondhand, and so you're affected with that. Again, hey, lack of exercise. I mean, uh, I've been doing some walks. I've been doing like 4 miles, at least 4 miles, almost on a daily basis. Today I didn't go because I had some early classes in Harlingen, but tomorrow I'm going to go walking. So we need to keep up. They say that at least 20 minutes of exercise or something like that is pretty good, man. You can do an hour either by walking or exercise or something. You're going to change your life completely. Um, so especially some of you that have jobs where they're very stressful, you need kind of like that exercise. So that walk could be your me time, it could be your relaxed time, it could be your time to
Absolutely.
let it all out, and so it's very important that you do that and you make the time for that, porque uh you don't want to go before you have to.
That's true. I like the fact that you're mentioning exercise. And when with my weight loss patients, I tell them I'm not even asking you to go to the gym and pay for a membership, but have a device that counts steps. So the recommended amount of steps is about 10,000 daily.
Yeah.
But, that's a huge goal to meet initially, especially if you live a sedentary lifestyle. So what I recommend, I tell people, get a device, whether it be a pedometer, a watch, some sort of device, and track your steps for a week, daily steps for a week. So let's say you're doing 1,000 steps daily. So the next week, your goal is to increase, let's say 500 steps daily. So the next week, instead of doing 1,000 daily, you can do 1,500 steps daily. And this can be obtained rather easily. So for me, my rituals include one, I never go on elevators. I always take the stairs, always.
Hmm.
And that's
Hmm.
that I go downtown and see patients in that the tallest building in Brownsville
Oh,
that
wow.
we have. I take the stairs to those floors. I don't.
Dude.
Mhm. Anytime I go on vacation, that's not very often, but the once in my lifetime that I've gone on a vacation, I again, I don't use elevators in the hotels. I always take stairs. I work the hospital. I always take stairs. I
Well,
tell
that's
people
pretty
don't park
cool.
your vehicle right in
Yeah.
the entrance of the store.
Yeah, you go
Before,
around, you go around, you go around to get a park. No, no, park away and walk a
yes,
little further.
yes, yes,
Sometimes you can
yes.
even park away and get to park under a tree so you get some shade for your car and nobody's gonna bump your car and you can walk in. So it's a win-win. Plus, you walk in, let's say you're at the edge of the Walmart parking lot and you walk in, man, you're gonna hit your goal at the end of the day. I mean, because you're walking around, and while you're in there, walk around. Go all the way around the store a couple of times, and then go home.
Absolutely.
you know?
I agree with that. People would say, I tell teachers, you know what, instead of sitting down while your students are taking the test, walk in between the rows of
Yeah,
desks.
yeah.
Try to find ways to just get a little more steps. I think
It's
people
easy.
think, oh, I got to go to the gym or something.
Yeah.
I'm not asking for memberships,
No, you don't
just
need to.
simply, yeah,
I mean,
because
the thing is, create movement. That's what it really says. Create movement. Business or the money industry wants to send you go to the gym, but really, all you got to do is create movement. If you can create
sure,
movement, I mean, back in the day when people were a little bit healthier than we are in general, they didn't have gyms. They weren't going for runs. They weren't going for walks. It was just everyday living where they were in shape, man. Those people were in shape because they worked hard and they did everything. It's kind of like I'm thinking about the Rambo movie when he goes to Russia and he's training, with no machines, and the Russian guy's training with all the machines and all the scientific formulas and all of that, and
sure.
and Rocky's just, hey, a stone here, a stone there. Let's run up and down a mountain. Let's create weights somehow in a natural way, and that's what you got to do sometimes.
Absolutely. And the gyms are not bad places. They're good places. As a matter of fact, I have had gym memberships myself. I have workout equipment in my house. And so, there's a place for all of there's a time and place for all of these. So gyms are good if you want to, create resistance or you want to know exactly as far as weights and stuff. So there's a place for gyms. I actually like gyms. I'm not opposed to them. But the reason I mentioned the things with the gyms is simply because a lot of times there's a lot of issues with cost, and some people don't necessarily have the funds for a gym. And I just want to make it clear that it's not about spending extra money. It's about, just like you said, just move. Be aware of how much movement you're doing and slowly increase that. If we're doing 1,000, then do 1,500 for the following week. You get to 1,500, okay, let's do now 2,000. And just always be aware of how much movement you're doing.
Hey, the phones nowadays, I have an app. I'm an Android user, and I have a
Yes,
Samsung app and Samsung Health, and it tracks my steps. It tells me how many miles I walked. It heartbeat and all that. I'm not really into all of that, but I'm just more counting the steps. Actually, more miles, but it gives me the steps. It gives me what else? Let me see. I'm gonna open it up right now. So it counts the steps. I know there's stuff on mindfulness. There's abs, heart rate, stress level, and
yes.
water intakes. How much do you sleep per night? I
That sleep
mean,
is very important.
I mean,
Sleep is
eight
very
eight
important.
hours or at least better than six. At least do better than six. Some people, hey, they can't do that, pero you know, uh,
So
you
sleep is
gotta
important. And
try.
what I tell people about sleep is that it may not necessarily be the amount of hours, but it's the quality of sleep. So
Yeah.
I'd rather have somebody sleep 4 hours that are very restful, that go into the deep sleep, the REM, the rapid eye
Hmm.
movement sleep,
Yeah.
versus somebody who sleeps 6 or 8 hours, but's not hitting that target REM. They're, they're waking up, they're in the light sleep. It's in the REM stages of sleep that we recharge our batteries. So
Right.
it's
Right.
important that we get to those. So it's not necessarily about the hours of sleep, it's about the quality of sleep. But sleep is extremely important for a lot of things.
Yeah, yeah, yeah. And so, but because you don't want to get into the complications of this, like heart disease, strokes and kidney damage or kidney failure, vision loss, and that kind of deal. Is you don't want to get into those because, man, then you got to deal with the treatment. And guess what? What we're talking about is part of the treatment. So if you
Yes.
can start
Yes.
doing what we're telling you to do, guess what? You don't have to treat it like it's treatment, but you treat it more like it's maintenance. And maintenance is a lot easier than treatment. When you take care of your car and you change the oil and you change, rotate the tires and you check the tire pressure and you do all these little things that you got to do to your car to keep make sure your car is maintain it. It's not that expensive. It takes a little bit of time, but if you don't do that, then you're gonna have problems with your engine. You're gonna have problems with other stuff, and it's going to run into the $2,000, $3,000 mark. And who knows, if it's really bad, that car might be out the door useless, and you're gonna have to buy a new car or a used car. But still, because you didn't do the maintenance, you wind up spending more money later on. Same thing here. The maintenance is, hey, let's walk a little bit, let's get some sleep, let's drink the
Yes.
water, let's do
Yep.
all these little things that are maintenance that don't cost a lot of money, but because later on we're gonna get the big medical bills. But even then, forget the medical bills. It's the shortening of your life. It's the
There
shortening
you
of
go.
your lifestyle, because you have to change. At that point, you're going to have to change your lifestyle whether you like it or not. So might as well try to do a little bit of the lifestyle changing right now, where you don't have to do it. Later on, you're going to have to do it whether you like it or not. Yeah. Next one.
Saul says car care analogy is excellent point, and it really is. It really is a great analogy, because if the car's not running well, check engine lights come on. We have check engine lights too. It's just that they're not as obvious. You have to go to see your medical provider, and then they'll interpret what these check engine lights are
Yeah,
on our
yeah.
body.
No,
But,
we're
but
we're
yes,
we're an engine. We're an engine, guys. We're an engine. We're an engine. We don't look like one, but there's all the functions that are in the engine. We have water, we have veins, we have blood that's going through that, making things going. Creating the functions and different things like that. You know.
I agree. I agree. So yes, we'll keep up with the car stuff. It really is. It really is. It is a good analogy. All right. So
All right.
this is to answer your question, Saul, about what can happen as a result of hypertension. So if we have hypertension and it's not treated, what can happen to our body essentially? We can have things like heart attack or stroke, as you mentioned, Ray. Things
Hmm.
like aneurysm. These are
What is
artery.
that? What is that? I've heard of that. What is it?
Yes. So aneurysm are basically arterial walls that weaken, and they have like a balloon appearance in the weakened areas. And what happens is that weak area can eventually rupture, and if that does rupture, then you're kind of bleeding all over the place. These
Oh
can
my
happen
goodness.
in your mid abdomen, in your stomach, or in your head. So these are like
Wow.
ticking time bombs. Somebody with this particular condition may not know, again, no symptoms, may not know they have this, but all of a sudden blood pressure goes high. It puts too much strain on the arterial wall. It bursts that artery and then they die. So this is a big, big thing. Other things like heart failure, as remember, the heart is also a machine. And if we keep overworking it, at one point in time, the heart's going to be like, forget y'all, y'all not helping me. I'm going to, start failing. And then we'll have symptoms with
Yeah.
that. Kidney damage, the kidneys have very small vessels. And if the blood pressure is continuous, then those little vessels can be damaged. And if they're damaged, then the kidneys don't work properly. They don't filter things like they're supposed to.
Mm.
Vision loss is another thing. We have the vessels in our eyes that are extremely small. I don't know if you've ever seen some people that they end up with like little blood stains on their eyelids. I mean, on their
Wow.
eyelids. I'm sorry, on the eyeball. Blood stains on the eyeball, and this can happen because little vessels rupture with elevated blood pressure and other things. But elevated blood pressure is one of the reasons why that can happen.
Wow.
Changes with memory or understanding related to decreased blood flow to the brain. So anytime you have decreased blood flow, remember that blood is where our nutrients and vitamins and oxygen go to. And so we have a decrease or interruption in the blood flow there, then you're going to affect the artery that is targeting. And in this case, it's talking about decreased circulation to the brain, and the memory is going
Wow.
to suffer as a result.
Hmm.
So these are some pretty devastating things, you
Yeah,
know.
yeah.
A heart attack can, you know, create a place where now
Mhm.
you're activity intolerant. You're not able to do much walking. You may have to end up living a sedentary life depending on what part of your heart is affected. A stroke is also another one of those devastating things where you could end up paralyzed from half of your body,
Mhm.
where you have difficulty swallowing, you know, difficulty maintaining lubrication to your eyes. So you have a bunch of, you know, your eyes are dry, drooling, just difficulty moving around. I mean, if you're paralyzed from half of your body, then the other part of the body is having to compensate and carry that.
Yeah,
And
yeah,
that
that's
can be
true.
really devastating. We talked about aneurysm already, heart failure. When the heart, the pump doesn't work well, then we can have things like swelling to your ankles. We can have a cough with clear phlegm or pink frothy phlegm. We can have activity intolerance where even in worst case scenario, people just sitting at rest, just existing, have shortness of breath. So it can be really devastating as well.
Wow.
Yeah, so these are things that are significant. Again, remember, you know, we go back to the statistic where 46% of people who have high blood pressure don't actually know they have high blood pressure. So guess what?
Mm.
They're at risk for these particular things because all these years they have high blood pressure, and since they're not aware, they're not receiving treatment or anything for it.
Yeah,
So
yeah,
these
that
are
makes sense.
so the question here is, why aren't people getting diagnosed with high blood pressure? Again, lack of symptoms. The majority of the time, again, known as silent killer, people aren't, I feel well, people being reactive instead of proactive. I feel well. So clearly nothing must be wrong with me. And the second reason is because if you don't check your blood pressure, then you're not going to know that you have high blood pressure. The way we get diagnosed with high blood pressure is two readings of 140 over 90 on two different occasions, meaning two different days, not on the same day. So if you're not having your blood pressure checked, again, you're not being proactive, you're not going and getting a physical exam, or you're not randomly checking it at HEB or Walmart, or you don't have a cuff of your own, then you're not going to have an idea that your blood pressure is running high. And so those are things that we should be, you know, having checked or checking on our own, so that if you have high blood pressure, it's addressed and the numbers are, you know, brought to where they need to be. You know, now either it's a primary issue where it's blood pressure itself, again, related to one of these particular issues, salt or poor exercise or
Mhm.
genetics or obesity, you know, or it could be something like Norma mentioned and the anxiety. In that case, we would need to address the anxiety issue and so that we could address the blood pressure. Now, if the anxiety isn't treated in the short term, then we could possibly treat the blood pressure. Um, you know, because some of these anxiety medications and depression medications take a while to work. So if
Mhm.
we're going to treat the patient for, if the patient's anxiety is not going to be done and out with for a month, then we may want to consider placing the patient on a blood pressure regimen. And
Wow.
then once the anxiety is controlled, then we can revisit the blood pressure and wean them off of that medication if, you know, permitting. Again, because each day that your blood pressure runs high, again, we run the risk of issues with end organ damage that, you know, we talked about here: heart attack, stroke, aneurysm, heart failure, kidney damage, vision loss, and those things.
Wow. Very, very cool stuff. Very, well, the information, it's good to know these things because, uh, we don't, well, knowledge is power, guys. Knowledge is power, and knowledge can save your life, and so, get on board, do what you need to do,
Absolutely.
you know, do what you need.
Absolutely.
I was thinking of, things that came to mind is, I mean, hypertension may be silent, but its conclusion, its consequences is loud, and it's often invisible. It just doesn't affect individuals. It burdens the family, the community, so You've seen the risks. You explore the science here. So the question is here: what are you going to do today to protect your heart tomorrow? You know,
Absolutely.
because that's one of the things we got to do is how are we going to protect our heart so that tomorrow our heart is working at at top performance. And so we don't think about that because we assume we're going to live forever. It's not a song. You're not going to live forever. you know that's the
Yeah.
you're not
Time
going
is
to
very
party till it's
limited.
1999 forever, that kind of deal.
Yeah. Time is very limited. Time actually is very short. So before you know it, we're here today and then we're not. So we need to really make the best of what we do have. That's extremely important. I've seen some really young people die from heart attacks, aneurysms, and or have devastating events like have a stroke because blood
Mhm.
pressure wasn't controlled. And these are young
Yeah.
people that have to live the rest of their life with half of their body paralyzed. So it's pretty
Wow.
extreme.
Well, let's talk about the treatment.
So let's talk a little bit about treatment. Okay, I've waited. Now I have this. What can I do? So there's a lot of medications in this category, and they serve different purposes. Again, we're looking at what are the issues that's causing the blood pressure. That's what we want to address. We want to attack that. So we have diuretics. These are water pills: hydrochlorothiazide, Lasix, spironolactone. Remember, we talked about that one of the areas of concern is people taking in too much salt. Well, this can help,
Mm.
reduce some of that stuff there. Um, Salt retains water, and if we're carrying excess water in our body, then that burdens the heart. So what these water pills do is they throw out the excess water. We
Mm.
have other medications like ACE inhibitors. This is a real common drug class. I use this quite a bit. Lisinopril, benazepril. These medications, more common side effects are like dry cough. So we just have to watch for that and make sure that this is not affecting the patient because they will come to you and tell you, I don't know what the heck is going on, but I've had this cough and it's not a great cough. So that's somewhat the issue. If you start somebody on this medication and they start coughing, we got to switch that out. So,
Mm.
first line treatment, I can use a water pill if it's something that's very borderline, but I use lisinopril a whole bunch. ARBs are sort of a cousin of the ACEs. Losartan, I use that quite a bit too. That also can cause some coughing. So we have
Mhm.
to be careful with that as well. We always want to check blood pressure before taking these medications to make sure that it's not already low and we're bottoming the blood pressure out.
Mm.
Again, low blood pressure can have other symptoms that are extreme, like dizziness, a weakness, you can faint. So, we need to make sure that we have high blood pressure, but not bring it to the point where it's on the other extreme.
Mm.
Other classes of medications are calcium channel blockers like Norvasc or Cardizem. I use those medications too. Common side effects, swelling to ankles. This is not water retention. This is more movements of fluid through cells. So, but this isn't something that you reduce the dose. It usually subsides. Depending on how bad it is, then we can either change the medication or leave it as is. Other medications, beta blockers, these are pretty common too, especially for weakened hearts. Atenolol, metoprolol. Most common side effect are low pulse and feeling tired. These patients complain of, I just feel so tired, feel kind of weak. And it's pretty
Mm.
common, So I try to use low doses of these medications. Same thing with the alpha beta blockers, Coreg and Labelol. From all these medications, I tend to use Coreg and metoprolol the most, but any of them are acceptable.
Mm.
And then you have also the alpha blockers, which are the doxycycline and the prazosin. And these are some of the treatments that we use most commonly for blood pressure. If the blood pressure is borderline, then you may just get one drug like a hydrochlorothiazide, small dose. If your
Mhm.
blood pressure runs significantly high, I've seen people on 3, 4, 5 medications for blood pressure and still having
Wow.
some issues with controlling the medication. So, controlling the blood pressure, I'm sorry. So it just depends. Again, genetics plays a big role. If we have somebody who's very overweight, who eats poorly, who doesn't exercise, who has mother and father and grandparents with hypertension, then
Mm.
again, these people are likely going to be ones who take more than one medication to control high blood pressure.
Hmm.
In the next slide, we talk a little bit about how to take your blood pressure. That's, kind of important thing too. If we're looking at values, we want to make sure that we have correct information. Because if we get incorrect information, then we could more than likely make incorrect decisions. If you get a false high blood
Mm.
pressure,
Yeah, yeah.
then that's not something that we don't want to falsely treat a false high blood pressure. So now this is kind of a procedure for the cuff that goes up on the antecubital, right above, that's here in this area. So this procedure is for a blood pressure cuff like that. And we always want to start with choosing the right cuff. I'll be honest, before I get into this, usually I recommend that my patients do a wrist cuff, and a wrist cuff looks just like this. Pretty easy, you just put it on your wrist here, snap this on, and then press a button, and it's pretty easy to use versus the one that you put up here in this area. You have to use that correctly. Although it's said that the one on the arm, this area is more accurate, it's more difficult for that to be accurate if the steps that I'm talking about now aren't
Mm.
followed. So if you miss some of these steps, then it's actually less accurate. Whereas the wrist monitor, this thing right here, it's pretty easy just to place on your wrist and take it. You don't have to do a lot of these steps that we're talking about here. So when I'm telling my patients that I'd like for them to send me blood pressures, I tell them just get by a wrist cuff because it's so much easier to use. So what we always want to do, regardless of the type of blood pressure machine, is choose the right cuff size. That's important. In the arm, if it's too tight, you can get falsely high blood pressures. If it's too loose, you can get low blood pressures. And then we
Mm.
want to talk about the cuff size. So there's different lengths of cuff sizes. There's some that we use for babies, for children of different ages,
Right.
and for adults. And then in the adults, you have the small, medium, and large. So you want to look at your arm at the circumference, and there's measurements on there. Usually a general, cuff where just the one that's used most commonly comes. If that works for your arm, great. But if it doesn't, then you're going to have to buy a separate blood pressure cuff. It's kind of like not an all fits all. You really need to have a good size there. And I have Juliana here saying hi. Hi to me. Hi, Juliana. How are you doing? Thank you. She's watched some shows before, but I told her you got to say hi. I want to know
Yeah.
that, that you're listening to me
That
and
you're
stuff like
watching
that.
us. Yeah.
Yes. So she sent a hi there. Uh, so we also want to prepare ourselves. We got to sit comfortably in a chair with our back supported and feet flat on floor. So you don't want to have your ankles or legs crossed, or your arms crossed. You want to sit comfortably with your back being supported and feet flat on the floor, uncrossed.
Hmm.
Again, we talked a little bit about position of the cuff. This place is important. We have to place the cuff on bare arm with the bottom edge on the bottom of the cuff 1 inch above your elbow. So again, we're looking. This is the antecubital space. This is the elbow. They're right on on the opposite side of each other. We want to put that about. We want to put the bottom of the cuff about 1 inch in this antecubital space here. And Juliana
Yeah.
says she's doing good. Glad to hear, Juliana. I'm glad you're doing good. Hope my show is giving you a bit of education. So we have to position the cuff correctly. Once that's positioned correctly, now we're talking about the tightness of the cuff. I talked a little bit about false highs and
Mm-hmm.
false lows in order to help determine if the cuff is tight enough or either too tight or too loose. We want to get 2 fingers and be able to slide those under the cuff, and they should fit snugly there. Again, if you can't get 2 fingers in there, it's tight, it's too tight. And if you can get more than 2 fingers in there, it's too loose. We want to start the measurement on the machine, and there's going to be a start button there. You just press start. You want to remain still. Don't talk or move your arm during a measurement. Your arm goes at heart level. So you
Uh-huh.
want to extend it out in the front of you. And if you don't know where heart level is, it's basically at your chest, wherever your nipple line is. For men, women, that can vary. But for men, right at the nipple line is where that's at. And for women, they can just simply relax their arm on right at the edge of the breast, and that would work out. So then we want to record the reading. We want to note the numbers displayed on the machine. That's really important. And the machine's going to give you three different values. It's going to give you the systolic and diastolic number. That makes up the
Hmm.
blood pressure. The systolic is the amount of pressure exerted while the heart is actually pumping. And the diastolic, which is the bottom number, is the amount of exertion that the heart exerts when the heart is at rest. And then you have the heart rate. The heart rate is also important because the heart rate gives us information regarding the heart, and also helps us evaluate blood pressure better as well, especially for people that are sick, and we need to make decisions regarding that. Now, remember, if you're taking a blood pressure medication, especially the beta blockers, the beta or the beta blockers, the atenolol, metoprolol, correglar, betalol, we want to evaluate the heart rate. If the heart rate
Hmm.
is below 60, then we want to talk to our healthcare provider and be like, hey, my heart rate is at this value. Do I need to continue? Do I not? And seek guidance from your healthcare provider. That's extremely important. And this is essentially the last slide here regarding how to take blood pressure. And then we have someone who's saying hi here, Adriana
Hey, Adriana,
Barrientos
how's it
from
going?
Argentina.
She's
That
my
is super
co-host
freaking awesome. I
from,
love it.
yeah, she's
I
cool.
am super honored,
Yeah.
honored all the way from Argentina. Makes me happy. I like
Hola,
that.
Adriana. ¿Qué tal? So great, yeah. Now the thing is this, uh, when you go to the Walmart or you go to the Walgreens or you
Yes.
go to the CBS or I don't know where else they would have them, but I guess Target, places like that, and you sit down and you do it yourself. uh I guess it's, if you don't follow the steps, you're just wasting your time, right? I guess.
I mean, I don't want to say wasting your time,
Well,
but
I
what
mean, you
happens
don't
is the
have any
blood.
information to write down, or
Yes,
you don't know what you're
yes.
doing, right? Does that make sense?
Yes, yes, that's correct. So what we want to do, the whole purpose of screening, which blood pressure, taking a blood pressure is a screen. The whole purpose of screening is we want information. Not only information, we want accurate information. It's kind of like going to get a mammogram, and the person who's
Hmm.
taking the pictures isn't taking pictures appropriately. Then we can miss, masses that could potentially be
Right.
breast cancer. And so it's kind of the same token with the blood pressure. If
Hmm.
we're receiving a number, we want to make sure that that number is as accurate as possible. Now, those places, the cuff is already set up, so it's a little easier. You don't have to do the setting up part. We just got to make sure it's your right size. But when you put your arm in there, you want to make sure that it's about an inch above the antecubital space. You want to make sure that your feet are on the ground and not legs crossed. You want to make sure you're not talking. Now, those particular machines are going to tell you whether blood pressure is normal, whether it's, somewhat elevated, or whether it's grossly high and you have an issue. So, what I would do is take that particular blood pressure, and if that number is abnormal, it warrants you. It doesn't mean, oh my God, I have high blood pressure and now I'm dying. It means simply, hey, further evaluation is needed. Let me go see my healthcare provider and let me seek further information. I have a comment here
Mm.
from Saul. He says, diabetes can damage the kidneys, and the kidneys usually control blood pressure. Diabetes can be a big problem, causing secondary hypertension by damaging the filtration of the kidneys. So keep your sugar levels under control.
Yeah.
Absolutely. I had someone recommend to me off our chat here that I should do a presentation on diabetes. And so I definitely, that's another
Yeah.
complex illness. So, down the road, I plan to do something on diabetes. So,
Yeah. Yeah.
all this feedback is excellent. Even if you're not giving me feedback on the actual show as to what topics you want, because maybe you're a little shy, I'm okay with that. I can be shy as well. Send me a message. Either send me a text, um, and let me know what you're interested in. Again, here's my phone number with some services that I offer: 956-640-6963. And I'd love to hear what you have to say.
Cool. Cool, man. So it's a great hour, man. It's got great health time. Let's talk health, and then, wow, blood pressure. It's like, you know, uh, don't don't bring it in your house. Don't bring it
Oh,
into your system. That kind of deal. It's not good for you. And so, uh, it's like I said earlier. And Sharon was saying this. Well, it's a silent killer. We don't know when it's coming in, so you gotta be very cautious about that, because otherwise, you're going to get into. When was the last time you were checked? When was the last time you checked your blood pressure? And what did it say about? And what does that say about your future? I mean, I'm hearing this, and man, I'm thinking, man, I'm gonna go to Walmart and sit down and just check my blood pressure just in case.
absolutely.
Can you afford to keep ignoring the warning signs of a condition that gives us so uh you know the warning signs are there, but again, uh they might not be there because you're ignoring them. You know.
Absolutely.
Um,
Absolutely. And for those, then when they're not present, well, they're not present, but that's the whole point of being proactive versus reactive. Saul says, please let us know when you do this. I will have my students listen in. So every Wednesday at 8 o'clock p.m., I am on. Ray and myself are on. So yes, please have them, listen on. I am on YouTube, so they can listen either via YouTube, or they can come through Facebook. If they want the actual invites, then they need to request me, and then I can help them with that. If not, then they can go through YouTube and watch our program there. But
mhm.
thank you, I appreciated that. I love students. I precept students all the time. It's a passion of mine, teaching. I love to teach.
And guys, when the invitation comes out, go to the invitation on the Facebook invitation, and you can hit interested. But if you hit going, Facebook will send you a notification a few minutes before, actually an hour before the show starts. It'll send you a notification that the show's going to start, and then of course at, I think it's at 10 minutes, it'll send you another notification that the show's going to start. And so. Uh, it'll send you another notification, so you can just hit the notification, the show will open up for you. So it's real easy, that kind of deal.
Absolutely.
We'll do extra points for them. I think Saul was saying something about that for the
I love
students.
it.
Yeah.
Yes, yes,
It's
yes.
cool because nowadays, it's part of research. You can't just be studying something. You gotta research and listen to other perspectives and the people that are out there doing it. Because one thing is theory and another thing is practice.
I
you
agree.
know and so practice is always not more important, but it's reality, it's the real deal. And so you got to deal with reality. You got to listen to what practice is saying versus theory, but keep in mind that theory is very important too, because without theory you don't have practice. But when it comes down to it, the practice is what makes the theory you know
They go hand in hand.
they go
You
hand
know,
in
we're
hand.
practicing, we're
Yeah.
practicing theory, but practice without theory is, a
Yeah.
practice that's not guided by education. And theory without practice, well, it simply is just theory. There's no
Yeah.
action behind it.
Yeah.
So, they go hand in hand. And that's
Yeah.
the whole point of these shows, is to provide the theory components, but then the individual has to practice themselves.
Yeah, yeah, yeah. Cool. Well,
All righty. Well, we are at an
cool.
hour, actually a little bit
Well,
over an
guys.
hour.
Yeah, that's cool. So, guys, have a super, super week. Have a great evening. And, guys, we're starting off. What's today, man? Oh, wow. what is it? One couple more days, and we're in June already,
In
man.
June.
So,
Yep,
oh
we're in
man,
June
this
already.
year's going quick, 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 quick. And so, hey, get ready for June, and then comes July the 4th, and pretty soon it'll be Christmas time again, and boom, and the year has gone by. So, make some of your goals. You still have time. If one of your goals was to lose weight, to be more healthy, hey, you know what? You still got 6 months to achieve that. You still got,
Absolutely.
6 months to develop the habits of walking daily, develop the habits of going to the gym, or develop the habits of eating healthy, or develop the habits of, maybe drinking more water. We tend to not drink a lot of water.
I
Uh,
agree.
you
I
know,
agree with that.
uh, you know, simple habits like walking outside for 10 minutes and getting some sun. Oh man, that's
Go.
a plus right there. You don't think
Vitamin
about
D.
it, but
Yes.
you don't want to go out there because it's too hot. Oh, it's too hot. No, but hey, you need it. You need vitamin D.
That's right.
Uh, that kind of deal. So hey, and thank you,
All
Saul.
right.
Este, hey, I'm just here. I'm just the pretty guy here.
There you go. There you go.
She's the brains. She's the knowledge. I'm just. Oh yeah, yeah. But
Okay.
have a great night, guys.
All right. Sounds good, guys. We'll see you next week. Thank you.